Hi everyone, welcome to my live session. I'm Dr. Rakhee, consultant pediatrician, and we'll be talking about ventilation and COVID-19 today with a very honorable, very honored to actually speak with Professor Dr. Jayakumar Gurusamy, who is actually the Deputy Dean and Professor of Community and Occupational Health of Manipal University College, Malaysia. Let me just add Professor into the call. Just give me Prof, I just added you in. Hi Alvin, hi Sharon. We're just waiting for Prof to just join us.
Hi, Dr. Rakhee.
Hi Prof.
Hi.
Oh, lagging a little bit. Thank you, Prof. It's lagging a little bit. Is it on my side or is it? Alvin, do you know it's lagging on whose side? Can you just?
Yeah, is it lagging?
Yeah, it's lagging on your side a little bit. Sorry guys, welcome to everybody on Doherty as well. Welcome to all my followers on Instagram. We'll just wait for Prof to just get the Wi-Fi sorted out. We're very honored actually to have Professor Jayakumar join us today. Is everything okay, Prof? Your side, all good?
Yes, I can hear you. Hi. Good evening and nice linking up with you, Dr. Rakhee.
Thank you so much, Prof. Thank you. So I've just introduced you a little bit, Prof side. So Prof, your Wi-Fi is a little bit slow. Just a heads up. We can't see your video very well, but we can hear you very well. So I will just carry on. First, we're going to talk about ventilation and COVID-19. There are a lot of people going out there wondering whether it's airborne. They're wondering whether it's droplet spread. So there's a lot of confusion. I in fact did a little poll a couple of hours ago, and I think 80% said it was airborne, 20% said it was droplet spread. So there's still a little bit of confusion out there on what it is. Prof, would you like to tell us a little bit about how COVID-19 spreads?
All right. Thank you very much for having me in your session. Basically, if we all recognize that SARS coronavirus 2 causes COVID, and down the line when it started off with Wuhan, we all recognize that the spread between people who are in close contacts. And initially, our thinking was it was more in terms of droplets, in terms of touching of inanimate objects, like touching tables or any objects, handphones. But down the line, as towards late 2020, CDC and as early as March this year, WHO also included aerosol as another mode of transmission. So basically, we kind of have three modes of transmission. We have the droplets, touching of inanimate objects, touching of tables or handphones, and also we have aerosol. That's basically, and something that we need to keep in mind is basically close contacts, because these air droplets have a range, and typically we're looking at aerosols, the thinking is 1 to 2 meters. That's basically looking at the transmission of corona SARS virus.
I see. Thank you so much for clarifying that. Some of us are actually a little bit worried when you say close transmission. That's why we're actually keeping away. So that's the reason why we're saying keep 1 to 2 meters apart. That's why we say physical distancing and everything. But then now they're saying that it can even stay on surfaces. So when your delivery guys drop off things, so some of us are even scared to touch our delivery items. Is that something we should be afraid about with regards to the droplet or surface spread?
Yeah. I think you asked a very pertinent question. When we talk about droplets and SARS, we need to keep in mind when we are talking or when we are sneezing or when we are coughing, or if you are trying to sing, we are actually spewing up particles, right? And the important thing about these are the particle size, right? So the smaller particles, we actually call it typically aerosols. the larger ones are droplets. The good thing about droplets is basically they fall because of the gravity, and larger size they fall and they touch on inanimate objects like tables and so on. And the aerosols, they tend to linger on a longer period and they move on a further apart. But since they are smaller, they evaporate faster, right? Coming to your question about inanimate objects, yes, the risk of transmission is there. But if you look at evidence that's coming out from CDC, the risk of transmission is actually very low. It is as low as 1 in 10,000 actually you're touching inanimate objects, especially if the objects are external, because externally you have UV radiation. So that's why there was a big controversy when local authorities started decontaminating public areas, you see. So the risk is there, but it's extremely low if you're looking at about 1 in 10,000.
So that further says that you should keep your hands sanitized whenever you touch any object. So whether it's indoor, outdoors, you know, like your condominium lifts and things like that, just keep sanitizing your hands, and I think you will reduce that risk even further. Am I right, Prof? Yes.
Basically, because when you're talking about aerosols or droplets, the mode of transmission is basically if someone is talking or we are in a crowded place, when we are talking, you have spews of particles going. And what happens is one mode of transmission is we inhale, we breathe in.
Yeah.
Another is if our hands are dirty or we are touching our face, our eyes, mucous membrane. Yeah. So yes, basic public health hygiene, that's the way to go by.
Right. Okay, so when suddenly CDC and WHO said that it's airborne, so now everybody started talking about ventilation. So it brings us to our topic today, which is why are we talking about ventilation? Why is it so important for us to know about ventilation when it comes to COVID-19? You want to tell us a little bit about why the importance of COVID-19 and ventilation?
Sure, Dr. Rakee. Okay, first of all, I must put a caveat to my statement. I'm a public health medicine specialist. I'm not an engineer looking into the technical aspect. Looking in the aspect of public health, as a public health medicine specialist, I think indoor ventilation has been underrated and spoken very little. And with the pandemic around, we need to recognize there's no time where during this pandemic we are spending the most hours in our homes, right? So it is said that 90% of our time we are actually spending indoors. And out of this 90%, when we say indoors, it could be schools, workplaces, or our homes. 70% of the time we are actually spending at home, especially, you know, with these different alphabets or MCO, CMCO, and EMCO, and so on. And that makes it important. And one of the things also we need to recognize is the spread of COVID or SARS-CoV-2 is we recognize, as we spoke earlier, transmission is close contacts. So close contacts, the distance makes a difference. Crowded places, right? Less ventilated places. So that's basically we are looking. And we also recognize that the transmission or the spread of coronavirus is actually quite alarming. It's quite spread. And what evidence is coming is actually the spread is actually related also to the phenomena of transportation of these aerosols or droplets, right? But there's not little we know about the transport phenomena, but as time goes on, more information is coming, and that is basically is important if we want to curb the spread. So the transport phenomena of these aerosols, droplets are important, looking at preventive measures.
So basically the 3 C's, which has been mentioned by our government many times, is reduce close conversations, confined spaces. Yeah, so these are basically the methods of improving ventilation. So, Prof, when you talk about ventilation, how can we improve ventilation? So the main thing that we want to know about is in our own home, because we're stuck at home most of the time. And then we're going to talk about schools, because schools are going to be opening up in September. And of course, offices, because I think half the workforce adults are in office. A few of them are at home. So I think these 3 areas are my main concerns about ventilation. How do we improve to safeguard ourselves from reducing the chances of us getting COVID-19? What can we do to improve the ventilation in these areas?
Right, sure. I think something that to keep us all in the same page, something that we need to understand about ventilation is basically when we talk about ventilation is either you have a supply of air or removal air in a space, right? And the reason we are talking about supply or removal is we are looking at three aspects. One is to remove the contaminants in a particular place, and then we are talking about having an ideal humidity. We are looking about 40 to 70% of humidity, and we are also looking at the right temperature, because temperature plays a part of what with regards to viability of the virus, right? So we are looking about temperature about 23 to 26 degrees in say workplaces or homes. And something that we also need to understand is, though there are guidelines about how you guidelines on ventilation at homes and offices, the ventilation as such is actually a complex phenomenon, right? So back to basics, I think in schools we study the three basic things that we need to keep in mind. One is basically we recognize that cold air descends and hot air ascends, right? That's something. And pressure, basically from high pressure to low pressure. I think that's something we recognize. And the third important thing is condensation. When we have hot air meeting cold air, there is condensation. A typical example will be if you open your fridge and if you don't close your fridge, and then you find there's condensation of water because there's meeting of hot and cold air. And I'm a culprit. I'll sometimes leave it at night, and my wife will say, "Hey, you forgot to close the fridge." So that is basic principles. So let's move to homes, because if you are talking about workplaces, it's a different aspect. Typically in our homes, we may have air conditions, or we may have homes without air conditions. Moving back in history, right? If you look at the old buildings, I mean, I remember many years back when I joined in HKL, there used to be Wisma Kayu. They used to have these louvered windows, no air conditioners, louvered windows. You have cross ventilation, and many of the hospitals, even in Malacca, we had these louvered windows. But in the 70s, we had this change. There was a shift towards tight buildings. Air conditions came in. And also, if you remember, in the 70s, there was this oil embargo, so saving of energy because of the embargo. So what happens? So-called tight building syndrome. So typically what buildings have, you have buildings, we close our windows, many buildings are sealed, there's no ventilation, there's no air supply. Because we are talking about ventilation, either you remove or you supply, right? So that's basically how you're looking. So now when we look at homes, few things that we can do. One is ventilation. It's kind of a tango between having comfort zone and having a cost factor. Because if we were to have an air condition switched on and we leave our windows open, it increases the cost, right? Because you are running your air conditioners and so. So typically, if you are, one of the advice is we say keep your windows open at homes, right? Of course, when you keep your windows open, logically it makes sense to switch off your air condition because you're running the system. That's one. Of course, one aspect is having your fans switched on and having exhaust fans. But it's not as simple as that, because when we talk about ventilation, we talk about airflow, and it makes sense to have a uniflow of air. That means to say one direction, right? So typically when we have the fans are in slow speed, it's away from us, right? Away from subjects. And if you are having an exhaust fan, typically we have the exhaust fan in our kitchen, we have it in our bathrooms. And sometimes what we do, we have a exhaust fan in the bathroom or the kitchen and we open the window. That is detrimental because you are allowing outdoor air. What our whole basis is, we want the indoor air to be out.
Yeah.
So it makes sense to close the windows, leave your exhaust fans open, right? And the same thing, in fact, for kitchen. So that's something that we can do for homes. And we also need to look at the direction of the airflow.
Yeah.
Example, if I'm sitting down in my workplace, or I'm seeing a patient, and you don't want a fan to face me, because whatever the patient is spewing out from the mouth comes towards me, right? So basically your ventilation is, you want it to go uniflow out to the windows. That's looking at offices. Now moving to, looking at homes. As we move to offices,
yeah,
it becomes more complex.
Yeah.
Right? Because typically in homes, we have split units, air conditioning systems. We need to keep in mind, split unit air conditioning systems, or even the cassette air conditioning, by and large, they don't have outdoor air coming in. You know, it's recycled air. I mean, you have a split system. It's in. You don't have fresh air. But in offices, it's a bit different, because we have what we call the MVAC system, mechanical ventilation air conditioning system. Of course, in the West they have the HVAC system, which we don't use because they have the heating elements, right?
Okay.
So in the mechanical ventilation, if you're looking at buildings, offices, typically we have a centralized air conditioning. Basically, the MVACs are centralized air conditioning system. But the catch is, most of these offices, they have in the system, they have external dampers and internal dampers. So the external dampers is to allow the air to, whatever the air within the space, in essence, because it's light in essence, and it goes through the external air dampers, and it's supposed to be released out to the external, right? And then you have the internal, where air comes in, right? So one is air is coming in, fresh air is coming in, and another one, you have what we have recycle air. So typically in the offices, what they do is they recycle, they close the external air dampers, right? And why they do it is because it is energy saving, right? Because when you allow external air to come in, you are actually running the system at a higher efficiency, and your cost is, energy utilization is higher. And it's also not that easy to, today, suddenly I get up in the morning to say that, you know, I just want to open it, because can your system accommodate? Because you need the engineers to advise whether your system is built to that specification. So what happens now if you want to allow the external air to come into an office space, right? Your system might not accommodate, right? So one way is, of course, we are talking about reducing the head count. That means you're reducing the number of people in that workplace. That's basically looking at offices. It's similar in the schools. It depends on what type of system we have. If we have the air conditioning system, it follows what we are practicing at homes. But if we have the centralized or the MVAC system, it follows what, it basically comes into like what offices happens. One more parameter is they talk about air exchange, right? So air exchange is basically how much of air in 1 hour is exchanged in a space, whether it's in school, whether in a hospital, or if you're talking in a factory. So if you look, and we usually, many countries or many organizations, even in Malaysia, the hospitals, what they follow the ASHRAE standards. ASHRAE stands for the American Society for Heating, Air Conditioning and Engineering Society. So they have the standards. So they will tell you, okay, like for schools, ideally you should have maybe 4 to 6 air exchanges per hour, right? In a patient room, you may want to have 4 to 6, you know. So the air exchange is so important, because basically this air exchange entails external air coming in, right? So that It's basically how we are looking at ventilation system in the offices and at homes. But we need to be mindful, ventilation system in the offices, it is complex. In homes, it is less complex. And simple preventive measures. One of the important things that actually have come out over the last 2-3 years is we are talking about simple things like toilet. You know, when we flush the toilets, typically it is advisable where we close the lid and we flush. Because there's this whole concept where studies have shown, we call it as toilet plumes, no? Under inverted commas, where when we flush, it generates aerosols. And interestingly, if you look at the studies, they actually said that some post-mortem findings, in fact, have seen in patients with COVID virus, SARS-CoV virus 2 in phases of patients. But at this point of time, they are not able to say there is a correlation, you know, that is a causative factor. But the advice is toilets has to be closed before we flush, because it actually generates aerosols, which are actually plumes. So these are basic things, looking at schools and looking at offices. And of course, in offices, we are also talking about exhaust fans, having ventilators switched on. So typically in offices, like in malls or schools or even offices, if you have an exhaust fan, the advice, the guidelines is 2 hours before people come in, say we are starting work at 8 o'clock in the morning, it is advisable by 6 to have a auto generated where the exhaust fan starts, and 2 hours after people leave, right? That's something it is advised. For bigger offices with air conditioning system, what they call it as purging of the air. In the air conditioning system, you purge. So basically, it's a manner where they remove the air out of the offices, and purging is advised for offices where there is MVAC system.
I see. So just to recap, Prof, so you've mentioned the various aspects of ventilation where it makes a difference between humidity of the air around, pressure and condensation of the air around it. You also mentioned a little bit about cross ventilation and the usage of fans or air conditioning, whether it's split units or cassette units. And then you touched a little bit about in offices where it's a little bit different, where they have an MVAC system. And HVAC is available in hospitals, if I'm not mistaken. So MVAC system where you have either internally circulating air, or there are some that you have an external damper that can remove the air, but when that is switched on, it reduces the energy consumption. And then finally, you talked about air exchanges, where we technically want between 4 to 6 exchanges per hour. And that's the ideal one, where even we recommend schools, classrooms to do as well. So which is why a lot of the private and international schools that have air conditioning, we're actually recommending them to open up their windows so there is cross ventilation. I mean, I grew up in a household where my dad was just constantly saying to open up the windows, open up the doors, make sure there's cross ventilation. And this is pre-pandemic, you know, so I grew up with knowing ventilation is very important in every household. So this is all just going back to the basics of making sure you have enough air circulation. But just to touch one small aspect, when you mentioned 4 to 6 exchanges per hour, in a flight, because I did a talk with a pilot recently, and in a flight, when you're in an aircraft, that exchange is more than 20 in an hour. So every 2 to 3 minutes, the air exchange on board an aircraft. You know, so that goes to show that how ventilation is really, really important, especially when you're in a closed, confined area versus if you're in an open area. So once again, the 3 C's: close conversations, confined spaces, and of course, your crowded spaces. So you want to avoid all of these 3 C's because it makes a big difference in terms of ventilation. So Prof, I'm going to ask you a little bit extra. This is just also on a personal basis. What about air purifiers? I have a few patients of mine, and even I have air purifiers as well. But do you think it's worth to, you know, invest in one at this point? And do they work for COVID-19?
Okay. Just before I answer the question, one aspect when we talk about opening the windows, we also need to be mindful of the quality of air outside. if you're staying in Klang Valley, you know, polluted. So it becomes tricky when we say opening of windows. It all depends. Coming to your question about air purifiers, yes, there are, especially now you find a lot of advertisements out there in the social media, in the press about air purifiers. I would think one of the things is you have commercial HEPA filters around, right? But when we look at HEPA filters, we also need to recognize there are HEPA filters, right? There are look-alike HEPA filters, right? So we need to be mindful of that. And if we are getting HEPA filters for homes, like what you said in the planes, their air exchange can range from between, it depends on types of planes, you know, from 8 to 20 air exchanges depending on the planes. So if you are looking at HEPA filters, basically we need a minimum standard, right? And one of the minimum standard we're talking about minimum is, we are talking about a value of 13, right? What we mean by 13 means, as I said, it boils down to size. So basically HEPA filters, where we call it as, if you look at this HEPA filters, they'll be written MERV 13, 12, 8, 14, and so on. What we mean by 13 is, that means 50% of the particles, its efficiency is, it can filter at least 50% of particles of size between 0.3 to 1 micron, right? And it can filter about 85% of between above 1 micron of size. And when we talk about micron, sometimes it's difficult to imagine what is micron. One of the things I always give analogy is, a hair, it's a size between about 50 to 70 microns. That basically we are looking at, right? So yes, HEPA filters are something that we can look at it, but the guidelines actually talks about 13, right? MERV of 13. Singapore talks about 14, but I think 13 it's a bare minimum. Obviously, the cost goes, it's more expensive if you increase the efficiency. Then you have such a thing as, they call another unit is irradiation, you know, upper room, ultraviolet germicidal irradiation units. Why we call it this upper room is typically in a say in an office, that is more in an office setup. Upper room is basically they keep it in the high up in the room. So the whole idea why we keep that up is because the ventilation system is from the ceiling. So before the air reaches us, it is irradiated, right? So you have that. Then you have a lot of ionizing sets and all that. But there are a lot of advertisements. A lot of them will actually say they are approved by regulatory bodies or even local authorities. But interestingly, if you look into CDC, their guidelines, they always advise caution when you purchase all this. Do not, whatever that is advertised, don't take it, everything is a truth. Do your homework well, and that's a word of caution. So to sum up, yes, irradiation sets, gamma irradiation sets, and HEPA filters are advocated for even for homes and hospitals. Of course, hospitals, they do use it.
Yep.
But even there are commercial ones from homes, yes.
What about location of the air purifiers? Like, you know, like some of us have it in our personal clinics for doctors or healthcare, or even for people in offices where they have the purifiers in certain locations. Is there any particular location based on the airflow? I mean, you know, the air condition, the split units. Is there any particular place we're supposed to put it so that we don't get the air to us and it sucks away all the COVID air?
Yeah. We need to be mindful when we talk about HEPA filters. I mean, both of us are in a space, right? In a confined space. We need to be mindful. If we say, supposing I'm a doctor, I have a patient with me, and the patient coughs, right? The HEPA filter is not going to help me or the patient at this point of time, right? So what's the function of HEPA filter? It's only going to help for those who are coming in after a while, because the system will take some time for it to function. So people have this thing, some of my friends call up and say, if I have a HEPA filter because I'm in the clinic or in the workplace, the caution is, keep in mind, basic public health hygiene comes in again. But if you have someone who doesn't wear the mask and we expect, it's not going to be functional. Typically, HEPA filters, the location plays a part, but if you are buying commercial ones, then you have issues with it, right? But if you are talking about like hospitals, they are properly located, they take into consideration of the airflow, right? So that's something that we need to be mindful. It doesn't help if someone coughs at me at this point of time, but it helps for those who are coming in later, because the system will take some time to act.
So it would help if after the patient leaves, we open the door, maybe open the windows, let some cross ventilation take place as well. That will further improve the reduce of.
Yes, of course, yes.
Okay. And then I just want to touch a little bit about humidifiers, because I know in our country we're highly humidified in Malaysia. But so is it still necessary to get a humidifier as well to improve or decrease the spread of COVID-19?
Actually, when you're looking in the local context, our humidifying rates are quite good, because we are looking between the values they're looking is range you're looking is between 40 to 60, 40 to 70%. And if you look at our humidifying, it's around 40%, 50%, 60%. So there don't seem to be any role for it, except in probably in more in the Western. But in Malaysia, I think we don't really have that issue. But the issue is actually more in terms of air conditioning systems, because typically I find in Malaysia, in Singapore, we keep offices, the air conditionings are it's typically very cold, right? Constant. So we are looking at a range, we are looking at a range between say 23 to 26 degrees centigrade. That's if you're looking at guidelines as prescribed by the Department of Occupational Safety and Health. They have a code of practice actually.
I see. That's good. So it's not really necessary for everybody to go out and buy every equipment that's available on online shopping platforms, So do your research, read up a little bit about it. Rewatch the video if you're not sure, or you may have missed whatever Prof has mentioned in the beginning. Prof, I know I'm going to touch a little bit, maybe not go into length, because the next part of our discussion is actually very lengthy, and it's with regards to hospital ventilation. But I just wanted to touch maybe a little bit about the differences between hospital ventilation and the rest of us, for the doctors and maybe the healthcare, especially those who are watching us from Doctor T platform as well. So maybe talk a little bit about the differences between the hospitals and what we can do to safeguard ourselves in a hospital setting.
Okay. Hospital ventilation system is actually, what we talk about is risk-based. It depends on which part of the hospital. Again, they follow the ASHRA standards. Many countries, including Malaysia, they go back to the US ASHRA standards. So typically, if you're looking like example, like a consultation room. So we are looking like 4 to 6 air exchangers, right? But if you're talking about, say, maybe in a treatment room, that will increase to 6 to 7 air exchanges per hour. But it increases. If you're talking in the wards and all that, it can go up to 10. But if you're talking in the operating theaters, it goes up to as high as 20. Right? So it's basically, it goes on the concept of risk. What is the risk? If you're talking of an infectious disease unit, the risk is higher. The air exchange it's more. But the repercussion of air exchanges, it affects humidity, it affects the temperature, right? So there has to be a balance, and that needs expertise. It's something that you need the experts to come in. Typically the mechanical engineers to come and advise, because it has a cascading effect to the rest. Again, talking about hospitals, we also recognize there are such a thing as negative pressure rooms, right? Again, these negative pressure rooms comes back to the basics of physics, or in the days of science, we talk about airflow from high to movement is basically from high pressure to low pressure. So in the context of infectious diseases like COVID, we are talking about. So the whole idea is why we have a negative pressure, because in negative pressure, the pressure is low, right? So when we open the room, we don't want the air to move out, right? The pressure is inside. Some negative pressure rooms, they have another room, what they call is anti-room. Room. Basically, anti-room is for the staff to change before they come in. Typically, looking at before the staff comes into the room, so there's another anti-room. That's negative pressure rooms. Then you have the positive pressure rooms. The positive pressure is a bit different. Basically, for immunocompromised, they are not contagious, but they are immunocompromised. So as we come in, we want the air to move out, basically because they are immunocompromised. So the positive pressure, the air movement is from high to low, so the air moves out. So that's basically looking at hospitals. But we need to be mindful. Another thing is, in the MVAC system, all this centralized air conditioning, there's such a thing as air handling units, and inside these air handling units, there are filters, right? And one of the biggest problem, I think, in this part of the world, even in Malaysia, is we are good in buying or setting up expensive systems, but there is an element of maintaining them. And if we take a step few years back, you know, quite often every 2-3 years you will read in the papers, this particular hospital OT has closed down, certain parts of the hospital has closed down because of fungus and so on. Because all filters, even in our air conditioners at homes, they have filters. The hospitals, they have filters. They have to be maintained, they have to be serviced, and they have to be changed in appropriate time. Because we are mindful, if the filters are not changed, they become a medium for cultivation of, you know, all this bacteria, fungus, and they will be spewing it into the rooms. So they need to be maintained. And that's the whole concept. Basically, when we find when the indoor air quality is poor, so they have this concept where they say, you know, you have sick building syndrome. You know, sometimes we go into the office on a Monday, Tuesday, and then we say, you know, we have this lethargy, headache, and transient. But when we leave the room, when we go back, it resolves. What is most sinister is when the air conditioners, especially in big buildings where they have places for what you call water tanks for condensation, right? They need to be serviced, because if not, it actually propagates Legionnaires' disease, and we know Legionnaires' disease can be fatal. It's a pneumonia, and it's very fatal, and probably underestimated in this part of the world in terms of underdiagnosis. So that's something that we need to keep in mind.
Yeah, because I have a lot of patients who actually message me, and they're very scared to even enter a clinic or a hospital building, you know. So that's where telemedicine has come into picture. But, you know, trying to reassure these group of people that, you know, there are a lot of other forms of ventilation. It's not as easy as just open your windows and switch on your aircon and service. There are a lot of other mechanisms behind hospitals, healthcare buildings, that actually ensures that the air that you're breathing when you enter these places are actually much more cleaner sometimes than the air on the outside, you know, because of all these air handling units, because of all these HVACs, because of the air exchanges that are happening. And some of us kiasu doctors that have our own air purifiers and all that equipment in our room. So, you know, just to give a little bit of reassurance to the public that, you know, when you do enter these places, not to say that you should enter for no reason and bring your children to the hospital, but, you know, if you do and if you need to seek treatment, you're more than welcome to come to hospitals or clinics, because they already have all these mechanisms in place to ensure proper ventilation for reducing the risk of spread of COVID-19. Well, I think that has been very informative for Prof. I just mind-blowing. I went for your webinar that was 1 hour and I couldn't stop. You know, it was just a lot of information, and for me, this was very useful information, especially so for all those who point maybe towards the end the replay will be available on Dr. T as well as on my IGTV platform. And please go and rewatch the beginning when Prof talks about how to keep your schools, home, as well as your offices, how to ensure proper ventilation. And also we talked about how important ventilation is to reduce the spread of COVID-19. So it's no more about, trying to think whether this is airborne, this is droplet spread, this is what spread. Just practice the public health measures that are in place, and know at the back of your mind that ventilation is one big aspect of all of this, put together to safeguard all of us. But on top of that, please go get your vaccinations as well. If you haven't got your vaccinations, I think this is really, it's like your bulletproof vest, so you still need to make sure you have measures in place. You don't wear a bulletproof measure and then walk around and say, shoot me, shoot me. So it's still, you wear it and you keep low and you make sure that you keep yourself safe with all these measures in place. Thank you so much, Prof. It has been absolutely wonderful talking with you. And to those of us who joined us from Dr. T as well, do let me know the comments in the comment section, and I will take them after this live, and I'll try to answer them as much as possible, and I will try to get Prof to maybe clarify if there's anything that is beyond my level. Thank you so much, Prof. Would you like to say anything before you go?
No, thank you very much. It's a pleasure to be linking up, and I think just before I end is basically to recap. We're talking about avoidance of the 3 C's, right? We spoke about avoidance of the 3 C's, contacts, crowded places. Basically we are talking about that, and something to ponder about. We talk about rights about clean water. That's something that we say. Having clean water it's a basic right. But when you're looking in the public health perspective, in the public health fraternity, something that is growing now over the last few years is talking about our rights of asking or demanding for quality indoor air quality. Indoor air, that's our right. If you have a dirty water, we complain, but do we complain when our indoor air, or there's pollution? We don't do that, right? So that is a paradigm shift, and I think the questions we have to ask is the community ready to demand for this? And I think that's something that we need to ponder, and hopefully we can go in the scale of demanding a paradigm shift to say that indoor air is our right as much as external outdoor air.
Yes, I mean, the right to clean air is something, it's a basic human right. So rather than just clean water, we need a lot of other clean things around us, especially now that COVID has told us that dirty stuff, you're going to get infected. So with that, thank you so much, Professor. And I hope to connect with you future again. And if there are any questions, do DM us after this, and I will try to get through we have 92 over almost 100 visitors on Dr. T watching this as well, Prof. And I will get to your comments and your questions right after this. Thank you so much.
Sure.
Take care.
Thank you. It's a pleasure.
All right.
Thank you. Bye-bye. Have a pleasure. Bye. Bye-bye.